What Steve is passionate about is using his skills to help improve life on Cape Cod, focusing on infrastructure and digital equity, the economy, and sustainability. He's held multiple roles at the Cape Cod Technology Council, including board member, committee chair, executive director. He's an avid bicyclist and kayaker and spends much of his time as he can with his grandchildren. Steve will introduce our panel. I am really glad to see all of you make it here today. We have some folks that are off Cape, some folks in healthcare. So everything that Mario talked about today, we're going to bring it into a Cape Cod lens. So it really has meaning for you. And Steve, take it away.
Great, and yeah, thank you very much, Mario. Although just one suggestion. Instead of starting with iPod and Carta, maybe start with 45s and Britannica. I don't know about the rest of you, but that's kind of where I'm coming from. I remember getting my kids in Carta and struggling with, where does this go? Anyway, we have a great panel. Again, we're going to bring this down to a hot focus. So Katy O'Connell is the Chief Information Technology Officer at the Community Health Center. Katy has 2 decades of leadership experience there, where she started as a volunteer in 2006. As the COO, Katy helped increase portal participation from 40% to over 70%. So perfect for this panel. She's passionate about using technology for remote patient engagement, staff satisfaction, especially as emerging AI tools reshape how we all interact with technology. Second, we have Dorothy Burritt, Director of the Eastham Council on Aging. Dorothy has been there for more than 14 years. She's secured a lot of grants and various programs, including funding to create hybrid programming, increasing access for seniors, both in person and virtually. She's a strong advocate for digital equity, ensuring that older adults have the technology and support they need to stay connected. We also have Kathryn Downs. Kathryn is an Associate Director of Ecosystem and Programs at the Mass Broadband Institute. Kathryn secured over $3 million in federal grants to support digital literacy and hybrid programming at COAs and started the Technology Learning Collaborative for Healthy Aging in collaboration with her colleagues at AARP, AGE, and Massachusetts Healthy Aging Collaborative. Kathryn joined MBI in 2023 to help administer approximately $400 million in federal and state funding for improved broadband infrastructure, partly here on Cape Cod. Welcome, Kathryn. And then finally, Elenita Muniz started her career as a corporate trainer for travelers. So we have the educator in the group, the trainer. She was 6 years as the coordinator for the Barnstable County Human Rights Commission, retired, did home care for her mentor, retired, returned to training with Elwood Services Cape Cod, hired her, and she continues that. So like many of us, she tries to retire, getting there. But it just goes to show you when skills are in need, there is always going to be somebody reaching out. So we're happy that we have such a great group here. We're going to start off. So Mario just shared a whole bunch of research on AgeTech adoption, and I'd like each of you to kind of weigh in from your perspective here on Cape Cod. Which of those trends feel most urgent and visible in what you're doing right now? Elenita, you want to?
I think in my experience, what is most needed is the very basics. A sense of confidence. People are afraid. I have so many students that come and say, I got a computer, my son got me a computer. I'm terrified to use it. So I think that sense of you can do this. You have the skills, you can do this. We are not ancient dinosaurs.
Thank you. From the perspective of the Massachusetts Broadband Institute, which is the state broadband office, so we administer federal and state funding, I would say what resonated most with me in Mario's presentation was the equation that access is about both availability and adoption. We have been historically, as a broadband office, which started in 2008, operating on a lot of infrastructure investment, some of which is here on the Cape, but only recently with the Biden administration really influx of federal funding have we been focused on the adoption piece of that equation. And there's more to do.
At the Health Center, we're really fortunate to have a digital navigator who's here today, Liam, sponsored by Comcast, and that hands-on assistance in an environment where, for the most part, we're already recognized as a trusted resource, and the the value for the patient to adopt our technology is sort of built in there. I think is that all resonates and sort of speaks to why we have been successful in helping to get people on board with the portal. Obviously, still plenty of work to do in terms of not leaving anyone behind. So from the health equity standpoint, it's just such vital work.
So I would say that hands-on, one-on-one approach, I think it's consistently having somebody available to walk and keep on our members and help them navigate their tablet, their iPhone. It's really a personalization. Everybody's got a different device. So we have found that really being available and helping them navigate whenever they need it is probably the biggest need, I would say, at a local level.
Great, thank you all very much. So we're going to dive into some of the specific issues now. And we're going to start with Katy. And I would like to point out that Katy is the only one of us up here who's actually using a digital tool for her notes, which I've always been very envious. I've never been able to quite master that, so we have an expert in the house, which is great. So the specific question we'd like you to talk about is, research highlights the role as trusted advisors in accelerating or stalling technology adoption. In healthcare settings, specifically, how do clinicians, digital navigators, care managers, and caregivers influence whether older adults adopt and stick with tools like remote monitoring or patient engagement programs?
So, I was going to apologize for being up here with my phone, but I'm one of the 50 to 69-year-olds whose age
That's what we're supposed to be doing, that's great.
And I'm also at a point in life where I cannot keep anything in my head without it written out. For better or worse, at the health center, digital tools are a necessity of us being able to provide care. We're trying to see more patients with fewer resources, and so we are been leading into using our portal, which puts pressure on patients if they want to be able to communicate with the provider. If you want to get your test results, we don't call patients generally with normal results. So providers, are having those conversations with their patients about how you're going to get your test results, how you can communicate with me, how you can request refills, how you can ask questions about your medications and so forth. And it's really been a game changer to have someone like Liam in a role dedicated to support patients when that becomes frustrating or feels out of reach. And I think, again, as I was saying, we're generally a trusted resource. So when the provider lets the patient know, or if the patient calls and says, I can't get into my chart, everyone at the health center knows, oh, you can talk to Liam, I'll put you through, or he'll call you at this time. He's available also to meet with patients in person. So if someone already has a scheduled appointment, he can arrange to meet with them before or after and be there with their device. I think in terms of like that building confidence, having an experience with someone who's going to help you get logged in, that you can call if you get stuck again, is really valuable for helping patients feel like they can take advantages of these tools. So whether it's using Zoom for a for a telehealth visit so that they have better access to the provider. Some of our providers have days where they are fully remote, so that's the only seeing them that day. Or also, when there's 2 feet of snow on the ground and it's not safe, to be driving or walking through icy parking lots. beyond the point of a patient who feels that this is how they have to communicate with us, I think people are excited to be able to see all of their visits in one place, to see their medications, to be able to access that information, when they want it.
Great. Now, do privacy concerns come up a lot in the clinic? I know personally, I've got my Siri turned off. I cringe at the idea of having Alexa listen to me around the house. What kinds of things are you hearing? How often does it impact what you're trying to do?
I mean, I think that's another area that, in a way, we're fortunate that, we must comply with federal and state regulations around privacy. And so we are very cautious about any technology we would ever ask a patient to use. And we're the customer of the technology we're asking them to use, not the patient. And so we require that vendor to be HIPAA compliant. The portal is provided by our electronic health record. Our Zoom is encrypted. It's secured. It's not, we pay extra for that level of encryption. And when we do remote patient monitoring, we're not asking a patient to, use their own personal device. We are issuing devices that are connected to our system. So we're actually very cautious in that regard.
Well, that's great to know. Thank you for elaborating. Because I know it's a personal concern, and I'm sure that. So thank you very much. We talked a lot about, if you're not connected, it doesn't work. So the next question I'm going to direct to Kathryn. We often talk about devices and training, but none of it works without connectivity. From a broadband infrastructure perspective, where do you see Cape Cod making progress? Where do you still see gaps in access, portability, Wi-Fi, etc.?
Thank you for that question. So I alluded to it previously that in the last kind of 3 years of our organization's history, our main mission has been to program and administer federal grant funding through both the American Rescue Plan Act investments, so as an immediate result of the COVID-19 pandemic, and then also from the Biden-Harris administration, the Infrastructure and Jobs Act, which released billions of dollars across the country for both broadband infrastructure and digital equity purpose. We've seen some shift in some of that change with the changeover in the administration of the White House, but the broadband infrastructure funding has really maintained and held. And so in the recent years, we've had the pleasure to deploy millions in 3 programs predominantly. The residential retrofit program, which the goal there is to upgrade wiring in public and affordable housing to replace what could be wiring installed in like the 70s or 80s and upgrade that to state-of-the-art fiber optic technology, which will be durable for at least the next 30 years. There are homes on the Cape who are participating in that program. And that program is actually really unique in that we have both the infrastructure funding and then we have complementary, what the program is called range funding, to support like the adoption piece to complement the internet connection to that person's home. So it's not just about getting, the upgraded fiber to the unit, which is honestly pretty rare to have programs that can do that. But it's also about equipping folks with the devices and the digital skills to effectively use those new devices. A second program that we've invested in recently is our Gap Networks program. Our Gap Networks program is focused on improving speed and availability of infrastructure at what is called broadband serviceable locations, BSLs, like residents' homes, businesses, other public places that have historically been what the FCC clarifies as unserved or underserved. So places that aren't receiving like proper speeds of internet and have just been outdated and need to be serviced. So we've been able to deploy millions of dollars into that program, also some of which is here on Cape Cod. And then the last program, which is our newest, and it's not actually yet active, we just recently received approval from the federal administration to move forward with our selection on grantees. But we're very excited that the BEAD program, which stands for Broadband Equity Access and Deployment Program, we're able to fund infrastructure investment here on the Cape for locations, those BSLs again, that have been historically underserved or unserved. So we're able to bring providers to the Cape to remedy some of those locations. I would say across those 3 programs, we're very excited to both honor incumbents who've been internet service providers here on the Cape. So folks like our sponsor Comcast, Open Cape, which is a local network here. And we've been able to help expand folks who are sort of newer entrants on the Cape, like Verizon, and then a company called AirVivo, which actually was operating completely outside of Massachusetts until these new federal investments had arrived. So we're really excited to improve the state of connectivity across the state and here on the Cape. There's obviously always, I think, going to be challenges in terms of connectivity. When we think about connectivity, the Broadband Office, our federal investments today have been really focused on availability, but we also, in our strategic framework of what we hope to achieve, we focus as well on quality of service, affordability of service, and adoption of that service. I would say in those 3 domains, we have made some progress, but there's always room to do more. So that's really what we're looking at in terms of the next chapter of our agency's work.
That's great. Are there any specific partnerships that you're working with on the Cape that have been critical to what you're doing?
Yeah, I would say in the infrastructure space, like very excited about the work happening with AirVivo and our residential retrofit program. They're one of our newer providers that are doing kind of like a different approach to their infrastructure wiring, which is very unique. I think one of the goals that we had in deploying some of our federal grant funded programs was to increase provider mix, increase competitiveness in regions like the Cape, and also through procurement methods. That's really the only lever that we have as a quasi-public agency to deliver our work, was to also improve affordability. And so some of those programs have, as part of the selection criteria, been able to promote that.
Great, thank you very much. So next, Elenita. Research shows older adults say yes when technology feels clear, comfortable, safe, and immediately valuable. This is right in your wheelhouse. In your experience working and teaching older adults, what makes someone lean in instead of pulling back?
I think, as I said, confidence makes a huge difference. Having somebody who, well, I can tell them when I start, I'm an old fart too, so I'm not here as some whippersnapper to try to tell you how this works. We're gonna work it together. And I also tell them that we're gonna make the computer work for us instead of the other way around, which far too often, that's how it feels. Like, we are doing all this stupid stuff. Where's the practicality there? I think necessity is one thing that makes people lean in. One of my favorite success stories is a woman who came into the class the first day and said, I'm afraid of my computer, I don't know anything, really dumb, I'm never gonna get it. And 3 weeks later, her son had a heart attack and she had to enroll him herself in my chart. So she writes me this little text, I'm not gonna be in class because my son's in the emergency room, I gotta enroll him, and she's like gangbusters going out there. Okay, scared of you, she did it. That's great, I think that's a huge motivator. I also think loneliness can be a motivator. But I think it's the fear factor. Every single class, I have at least one, sometimes more than 2 or 3 students who come in and say, well, my spouse always took care of the computer and now he's died or she's got dementia or whatever and I have to do it and I'm clueless. I have no idea. And they're so afraid. They also don't trust their own abilities and their own skills. Like when we were trained, sorry Mario, as instructors at Senior Planet, I said, what about handouts? And they said, oh, we don't want you to design your own handouts. I'm sorry, you cannot do this class without handouts. So I give my students a folder and about every class, I'm giving them a new handout. Here's the job aid. How do you turn it on? How do you shut it off? How do you do cut and paste? We had to do a whole class of cut and paste. They have the information, but then when you say, okay, now I want you to, I don't know what I'm doing. Like class 7, what's my password? Don't panic. That sense of like, oh my God, now I'm in front of this and I don't know what I'm doing. I think that's a really difficult challenge, and I'm constantly saying, yes, you know how to do this. You do know how to do it. Let's get out of the job aid. Let's go through this step by step by step. And I am starting from scratch 4 or 5 classes into the course. When you only have 10 classes, that's a little challenging, but 20 class course is better. I think that's the main thing. They want to be connected. They don't want to be dumb. They don't want to ask their kids or the nephew in Berlin who set up their passwords and then, we can only talk to him at 3 in the afternoon. It's crazy the things that stop them. But I really think that we need for them to understand, yes, you can do this. You can do this. We can do this together. And whatever repetition it takes. I think one of my fears always in my course is that they're with me for 5 weeks or 10 weeks, and then I don't know what happens after that, because there isn't really a follow-on that's set up. I love that there's drop-in hours at the COAs and at the libraries, but encouraging them to do this. I finally had a student call the senior planner hotline. I'm so excited. So that's the thing I would say that makes me.
Well, you've also highlighted a couple of other things. First of all, the value of having a local person do the instructing, because you know what the needs are here as opposed to somewhere else. And also, Mario's grandmother got the message long before his parents did, right? That tells you something about that intergenerational piece. Have you ever had any of your students kind of go on to become an instructor or continue to participate and help them know as people?
We have an upper K instructor, Danielle, and her students follow her around from course to course. They just keep taking, which is great. I have had a couple of students repeat in my class. Denise, did you start as a student and become an instructor? No, okay. So no, none of our instructors have been students, gone on to that. But they have explored other offerings, which is
No, my first meet with you, Elenita, was I shadowed you.
yeah, Denise was my assistant.
That's what you're talking about, is following instructor.
Denise Maggot, in fact, is another senior instructor, a senior plan instructor, and coordinates all the programming, registration and stuff, so.
Great, thank you very much. Dorothy, as we've talked about, many adults have devices but don't use them independently. In your work with implementing Clara's Companion, what are the differences you're finding between technology being there while being truly usable? I'm interested in hearing your experience with that.
So going back to what I said earlier, having that sort of one-on-one connection is key. When we rolled out the Clara's Companion, we were able to do it one-on-one. So I received the grant, the hybrid programming grant. So I was able to hire someone, get smart screens, tablets, a lot of equipment that could support our older adults that weren't already connected. So we did set them up. It's a very user-friendly, you can customize. There's a check-in daily on the Clara's Companion. You can do bed reminders. You can actually, what we were able to do is load, put a button in there that would actually connect them directly to our hybrid exercise classes. So people could just jump right in and it's just a click of a button. So I think that ease of use is huge, that's tremendous. But again, it's that support. Clara's also offered an 800 number as well, the senior plan, OATS does. And that's key, but I think that local level is instrumental in all of this, having somebody available for that support. We also, as part of our hybrid program, we actually worked with a high school student who made it his senior project. He came to me and said, I want to do this as my senior project. And he worked one-on-one with our older adults as well. And I think going back to that telehealth piece, we reached out locally to the VNA as well as to the VA, and we arranged programs for someone from their organization to come in and give a class on their healthcare platform, so their patient portal. So our members came, they learned, But then we continue to offer that one-on-one support to help them, guide them, and navigate them. And that is tremendous. You know, we live out on Abergate, so we're in Eastham. So getting it to Hyannis sometimes is really difficult, or Providence, you know, to the vet's healthcare facility. And especially if you're a caregiver, if someone's got dementia or, you know, anything else going on, it has been life-changing for so many of our members. So I think, you know, where we've gone so far ahead, it's really instrumental. And nowadays, you know, everything is really online. I mean, everybody's being pushed that way. So we're on the ground just trying to navigate and help all of our members do that. Because we're here, you know, it's happening, and we've got to help and support them.
Wonderful, thank you very much. Yeah, and I'm glad that you're connected with the students. I mean, you all know we have great tech schools here on the Cape that are starting to provide services to libraries and COAs and the college also. I mean, great resources for us. We've talked a lot about what Mario has and we have about training and support. What about ongoing? Katy and Elenita, can you talk about how you dive into a little bit on the ongoing support? And once you've got people kind of keyed in, you know, what steps keep it going, and how you're working it?
Yeah, I mean, again, so fortunate to have someone who's dedicated to that role, but also I want to ensure that all of our support staff, frontline staff, have some basic training to support patients. So, you know, they can't get into the portal today. Someone that at the registration desk or answering the phones can help them sort of troubleshoot
You're getting the
that.
whole organization kind of involved in the training process.
On the ground level, you know, they have limited time, you know, they've got a line of patients, a line of phone calls, so if it becomes something a little bit more complicated, they'll say, let me have Wayne call you or, you know, get in touch with you. So, ensuring that there's that support across the board.
That's great, that's great. Elenita, anything to add?
I think actually sitting here listening to Mario today, it made me think even more that it's so important to have some sort of follow-up and some continuity. We do reinforce that there are tech people available in our local libraries and in the councils on aging and the hotline. But we don't really have that ongoing kind of practice. At the last class that I taught was a 5-week course, and at the end of it, we just added an extra class a week later. Bring your own device in, because they've been working on the computers that Comcast provides for us, which is not what they have at home. So bring in whatever it is you work on, and let's try and make this work on your own device. I think more of that is needed, because the classes, whether it's 5 or 10 weeks, it's just not enough. And there needs to be more of that.
Well, things change too, right?
Yeah,
So even
change all the time.
reflections and updates
Yeah.
and that sort of thing. Great, thank you guys very much. So we're going to dive into the trainer a little bit. So for Kathryn and Dorothy, could you talk a little bit to, like, where else would you like to see some train the trainer? Where can we expand to? We're doing libraries and COAs. Probably pretty ubiquitous in the other case, I'm not 100% sure about that. But where else might we leverage and look to kind of get into this ecosystem?
I think what we're doing now is great. I think you're absolutely right with the collaborations. I think going into more healthcare partners, I think that's kind of needed. We've sort of just scratched the surface, contacting the VA. I also think, tapping into the schools as well, continuing that. I think there's a lot more that can be done, especially with the kids and the tech, all these resources that we have in our community. I think there's a lot more that we can do. I think what we're doing is great. We've come a long way. I mean, COVID brought us to this place of, no going back, and we just keep moving forward. And we have to support that and continue the good work we've been doing.
Kathryn, would you like to add anything to that?
Sure. I think there's opportunity to increase train the trainer models, honestly, like in any trusted community center institution, like those are the places that people are gonna go for assistance, whether it's realistically offered or not. So like getting to those places in community that people flock to. So that could be like faith-based institutions, depending on the city or town. That could be, you know, a library or a senior center. That could be a YMCA or Boys and Girls Club. There's so much opportunity to take all of our learnings, I feel like, over the last 5-7 years and really scale the opportunity.
Wonderful, thank you. Paula, we have some time for questions if
We do.
we do. Does anyone have any specific questions for anybody in the panel or any person on the panel?
Oh, wait a minute. Bring up.
So we're specifically on the arcade end, so our challenge is the accessibility, like hotspots or things like that. So we did recently get an MPI grant, so we appreciate that, we got the devices and all of that, but it's the connectivity part for us that we're really hoping for, because without that, it's a challenge. Because some of our, like, exactly, our seniors just don't have Wi-Fi ability at all for access.
Yeah, and that's definitely something that we're aware of at our agency and need to make investment to improve. I think it's both the kind of the technology availability at somebody's home and quite honestly the cost. We talked a lot today from Mario's presentation about, you know, older folks living on fixed income and the way inflation amongst other factors of cost of living, quite honestly, in Massachusetts, housing, groceries, healthcare, your internet bill, I mean, we don't manage cell, but like your phone bill, those are just the realities of decisions that people now have to make in terms of what is a necessity. Even though broadband is not viewed as a public utility and regulated as such, you know, we at the Broadband Office certainly value the role that internet access plays in people's lives. And I think this group of people is proving through the work every day that like that extends to older people just as much as it does to children who are doing online learning. So there's a lot to be done. I don't have an answer for you, but I want you to know that our agency like really understands the issues that you're bringing to the table.
What else?
Thank you.
Hello. It's good to see you, Kathryn. I didn't know you were going to be here. My name's Bella. I work for the Executive Office of Aging and Independence. And Cape Cod's really unique, I think, in the way that the ASAPs and COAs are so well coordinated and communicate with one another, and even the fact that there's like a digital equity working group within the consortium is amazing and very unique in the state. And something that I've been thinking about more in my role as it pertains to digital equity is how to coordinate statewide resources more efficiently. I've noticed in different pockets of Massachusetts, there's sometimes a lack of coordination between local councils on aging, community centers, et cetera, when it comes to resource sharing. And so there could be a whole lot of laptops or old hardware or even digital navigators that could be going to new places and teaching people things or providing devices, but there isn't always like a great channel of communication. So I was just wondering, and anyone can speak to this, but Dorothy especially interested what you have to say, but yeah, I'm just curious to know what your thoughts are about that, and maybe how Massachusetts could improve in that area.
So I think the continued support through grants to fund some of these programs, devices, staff. Staff is always key, and that is probably the biggest thing that all of our COAs miss. We do a lot of good work with a little amount of people, so I think supporting that initiative, like I kind of keep going back to this, right? It's that support, it's that individual attention, it's that one-on-one, or having a tech drop-in class, bringing your own device. I'll kind of echo what Elenita said, having that device with you is key, because that's what you're using at home, right? So to learn on a different device, unless you're taking it home, if there's support for that as well, you know, continuing, as you were saying, to provide devices to our seniors. Unless you're taking that device home, it's very difficult, and a PC versus a MacBook, you know, they're all so different. So I think it's really that individual attention. So I think more support on the line level with providing more staff, funding for that would be tremendous.
Any others?
Any other questions? Oh, yeah. We're gonna make you run, Paul.
Steps, people, steps.
We planned this.
Thank you very much. Thank you all to the panel for being here. I haven't fully articulated this question, but it has to do with time and basically how long it's been since we've gotten from the iPhone to where we are here and what the next 20 years looks like. And one of the things that I think about a lot is sort of pacing and frequency in terms of people being overwhelmed and then how to keep revisiting so that they understand that these things that you feel like you may need to learn that seem intimidating, actually you do have time, and it's really more the persistency and the confidence that are the primary things that you need to focus on rather than the moment and the momentary success. And so I'm wondering how you all have thought about stretching that out further and convincing people that this is something that it may feel like it's immediate, but we do really have like a long process to build in order for everybody to gain that equity. I feel like there's something there to that in terms of changing mindsets, but I don't quite know how we have that conversation and then how we get that out to everybody. Do any of you have any thoughts or ideas on the next 20 years, for example?
Yeah, all of you could probably weigh in on that to a certain.
I feel like I can weigh in the least because I'm not doing this work on the ground, so I don't have the personal lived experience to share. But I will share an anecdote that actually came from a colleague at the National Digital Inclusion Alliance. He's historically done work in Colorado and I think New York, and he's really about digital navigator programs. And one of the things that he said that really resonated with my understanding of the digital navigator profession was like, it's not just about teaching people in the moment tech skills, like how to use a Dell laptop, how to use, Chromebook. It's about teaching the resiliency and the skills to be confident in trying new things and how to approach a problem that you may not immediately know how to solve, but how to find and pull on the right resources and training to attempt to solve it yourself, and hopefully have a great community resource like a digital navigator that you can lean on. He was likening it to like in elementary school, like how you teach kids math. Like it's not about solving like set problems all at the same time the right way. It's really about like pulling on your confidence, but also what strengths that you've acquired through like basic arithmetic or subtraction. I thought that was really interesting. I don't know what that looks like in terms of manifesting that into a curriculum, but the value of resiliency and just like navigation, like self-navigation was really interesting.
I love that you're asking about 20 years. Some of us don't have 20 years.
Anyways, yeah.
I think the fact is that as a trainer, I have to always answer the question, so what? And that I learned at the tractors. So what? It's like the 7th grader says, am I ever gonna need this? Really? Yes, you are gonna need this. So I tell my students on the first day, there's stuff we're gonna just skip in this book, frankly, because you don't need it. And there's a real difference in the mindset of my generation, which was not born with a computer in our hand, even though I've been using computers for 50 years, it's different. So the immediate reward is the motivator, really. Yes, we need more practice. Yes, we need more support. Yes, we need some place where they can go to get questions answered. But the main thing is teaching them, here's a useful thing, here's how it works, here's a job aid that lists the steps, you can do this when you need it, is really important. And one of the frustrations, of course, is updates, which our teacher has to me to do it. And now, one of the other concerns I just want to hit on is the online safety. I have a friend who recently was hacked for the 2nd time, and his voice taken, and phone calls made to his friends who are also elders saying that his niece was deathly ill and he needed money. And this one friend, her caregiver, came in and she's writing a check. And he feels like crap. I am hearing desperation in his voice. he can't take it anymore. So that support is really needed. And we're not really worried about what happens in 20 years because we're trying to deal with what's happening right now. It's just really hard sometimes. Sometimes it's wonderful, but sometimes it's just really hard.
In my mind, I think it's the security and the access that over the 20 years is what's important, because the interface, will probably become very natural and you'll think you're talking to a human when you're trying to navigate something, but the security concerns, it'll be so much harder to detect something that's fake, and making sure that people have access to a tool like that.
Time for one more question?
Who do we address the request for training for the trainers? Nobody?
Elder services.
No takers?
Elder services is running.
I'll rephrase the
I would
question.
say, I'm not sure what community you're from.
I'm from Harwich.
Okay, so, at our level, at the COA, what we're trying to do is reach out to the schools for us. I can't speak to your specific community. I think this is kind of at a localized level for me. That's kind of how I'm viewing it, where these guys are supporting us in bigger ways, but possibly contacting your community center, your senior center, the high school, working with those people to try to set up a program. I know that Senior Planet through Odes, I know that like Elenita, I can't speak for her, but Elder Services is they have a contract with Senior Planet Odes, and that's kind of how they initiated this program that they're rolling out.
I'm happy to tell you more about how that program works, but there's an existing partnership here throughout Katy through Elder
With Elder
Services.
Services.
So if there's a location that would be a good fit for them to go to.
So we have several classes planned, but I don't think that's what you're asking about. I think you're asking about train-the-trainer opportunities.
Right.
Now, through our Senior Planet license, we can train additional trainers. And that might mean that we change our delivery model. But that would be one of those regional conversations that would be really well shepherded by the Digital Equity Working Group of Healthy Aging Cape Cod. Because it would be like, should we change, Elder Services' current service delivery model so that it is more of a train-the-trainer and diffusion? But that's a big, that's a big decision that can't be made. There'll be resources out throughout the building, so upstairs are additional vendors. AARP is here with Senior Planet information, if I remember correctly. I don't see him up here, but he's probably already at his table. And if I remember correctly, because I am also a certified instructor for Senior Planet, is that I think they just opened up another training opportunity. So see Antron first, and then Elder Services of Cape Cod and the islands are connected with